co-sponsored between Marshfield Clinic Health System and Security Health Plan. So they are meant to bring you value and hopefully share some insight into some things that we're working on and things that may have an impact on your business. So thank you for participating today. We are joined by Scott Gooch, who's a physician assistant at the clinic, and I'll do his formal introduction in just a couple of seconds here, but just to get through some of our other kind of administrative tasks before we launch into that. This is being recorded. The presentation will be sent out to everybody that did pre-register, and that will be sent out by Ashley probably within about 24 hours of the conclusion of our time here together today. We also post these on our website, securityhealth.org, and it is under the COVID-19 page. There's an employer tab within that page, and in that section you will find this presentation and links to all past presentations as well. So please feel free to peruse those at your leisure and share them as you see fit. If we do have questions today, please use the chat or the Q&A feature that's within the WebEx, and Ashley and I will be monitoring those today, and we'll ask those questions of Scott along the way. You can send them to everybody or send them to us privately, whatever you wish to do. And then we do have a couple of other questions that we may ask Scott too that just come up along the way if we have any points of clarification we have for him. So let's see, is there anything else I've forgotten? I don't think so. I think that's all of the administrative stuff we wanted to cover today. So I'm very pleased now to introduce Scott Gooch, who is a physician assistant, as I mentioned before, works for Marshfield Clinic Health System out of the Eau Claire region and works in occupational medicine and specializes in work-related issues and illnesses. And Scott has been with us for not that long. Actually came to us about a year ago, I think it was, Scott. So he is a fourth-generation veteran. So thank you very much for your service. Spent some time in the Navy as a hospital corpsman and worked in several clinics and developed a passion for healthcare there. After his time in the service, he did enroll in Western Michigan University, got his degree as a physician assistant, and has worked in both Wisconsin and North Carolina in emergency medicine since getting his degree, but then really found his passion working on a job site as an occupational health doc or physician assistant, I guess, and really found a passion for working in that space, so transitioned to Occ Health, and we are very pleased to have him with us here today. So Scott, without further ado, I will hand the baton off to you. Please take it away.
Well, hello, everybody. Thank you for the introduction. I'm Scott Gooch, physician assistant, and joined Marshfield Clinic in July of last year after moving back from North Carolina. And so today I'm going to talk about a few things about how partnerships between employers and healthcare providers are going to help the employees and the patients. So that's me. This was actually me at my last job. I was working for MedCore as running the medical clinic, taking care of the workforce, building a pharmaceutical factory for Novo Nordisk, $2.2 billion project, latest, greatest, largest state-of-the-art life science biopharma facility in the world. And myself and a team of paramedics and other staff took care of the workforce. And that's where I got a real passion for this and learned a lot of the skills that have translated in what I'm going to talk about today and how it's going to benefit everyone. So some disclosures. The only financial interest is I am an employee of Marshfield Clinic Health System and its affiliates, but otherwise no others. And some of the views and opinions are my own. I'm also not an attorney, so when I do discuss some of the information or some of the different regulations and statutes, it's my interpretation of them. So we'll just keep moving on from that. Okay, so our mission with Marshfield Clinic Health System Security Health is, we're here to enrich lives, and we're going to do that. We're going to take care of everyone as best as we can. So we're going to innovate and use multiple different skills to really put the patient first, gain their trust, work as teams, provide the absolute best healthcare through the most advanced research, education best practices out there, while also maintaining affordability. You can have the greatest healthcare out there, but if it's out of reach financially or it causes tremendous impact, then that's its own detriment as well. So moving into some objectives. I've done education before, so I kind of wrote this as an educational lecture. So we're going to discuss a little bit about the impact of work-related conditions on the person, their family, employer, society. Discuss how worksite visits by healthcare providers or partners are beneficial for the employers, the employees, and the providers for taking care of them. We're also going to talk about gradual return to work programs, and then provide you with some resources to help for when you do need to take an employee, someone from the workforce. They either need medical care for an injury or illness related on the job, or they have something that can impact how they're functional. So moving along. All right, so why is this an issue? Well, the latest statistics I could find were from 2018 from the National Occupational Safety Highlights from the National Safety Council. So there were 4,493 preventable injury-related deaths at work nationwide. 4.5 million non-fatal workplace injuries and illnesses nationwide, and about 171 billion in costs. That's both direct and indirect costs. A little bit closer to home, Wisconsin, this is from the Department of Workforce Development. Their 2019 data showed that there were 106 preventable injury-related deaths. That's 106 people in Wisconsin that went to work and didn't come home. And every single one of these was preventable. Out of that, we had another 70,000, almost 71,000 non-fatal workplace injuries and illnesses. And this ranges from something as minor as a scrape or a minor cut or a bruise, all the way up to permanently disabling injuries. So the wide range here can have an impact. And so in employee health, we have a concept of, we have multiple patients. We have the injured or ill employee, the person, and by extension, their family. But also we have to take into consideration what's going on in the workplace with the coworkers. Because if somebody is out of work or if they're injured, well, maybe that same mechanism can injure someone else, or there's something going on at the place where they can, other people can get ill from it. Can we identify something and help mitigate that? Or if we have somebody that's injured and we take them out of work, well, we still have productivity, we still have a job to do. So the colleagues on the left and right have to pick up that slack. So we have to take that into consideration as well. Plus, we also have to consider the employer, because depending on the nature of the injury as well as the treatment, then we get into, is it a first aid? Is it a recordable injury, like a medical treatment case with the OSHA and other regulatory bodies that we have to report to? So we have to bring all of this into consideration. And so the best way to, as healthcare providers, is learn as much as we can about who we're taking care of. And for that, context is key. So it's lunchtime. Hopefully everybody's able to eat lunch. If not, I'm going to make you a little hungry. So these are two real life cases. So the first one is when I was a Navy corpsman. I had a Marine come in to see me and had sliced the palm of his hand open from one side to the other. And I asked him, well, how did that happen? Well, I wasn't wearing gloves when I grabbed on the turkey feathers. And I'm like, okay, aren't turkey feathers soft? And no, doc, no, the turkey feathers. And then the other one, the reason I have a pork chop is at the last job at the construction site, I had a gentleman come in the afternoon complaining of shoulder and upper back pain. Of course, I asked, well, how'd that happen? Well, I was lifting a pork chop and moving it. And I'm like, well, how big was this pork chop you were eating? He starts laughing and says, nah, doc, pork chop is what they call the term for the little pad that they'll put under the outrigger pylons for construction cranes. And turkey feathers is the term for the adjustable nozzles on military jet engines. And so those are razor sharp in order to be articulating. So context is key. So how many times have you gone to your doctor's office visit and they'll say, oh yeah, you have group A streptococcal pharyngitis. Okay, what does that mean? You got strep throat. So understanding the different terminology and what everyone uses can then give a common frame of reference to help understand each other better. Part of that is understanding the work environment. All work environments are different, but they have some common themes. So out of our 4 pictures here, we have a construction crew, we have a dairy farmer, we have an underwater welder, and then we have an office. Well, if we're going to do a job safety analysis, which for those of us that know what that means, and for those that don't, is we're going to look at a job, we're going to look at a task and see, okay, what are the steps? And then what are the potential hazards, the potential causes of injury, some of the things, the dangers we have to look out for, and how do we mitigate that? Well, for these road workers, well, some of them are wearing high visibility vests, some of them are not. With the dairy farmer, well, how many times is this person squatting down and bending over like this? And if he has 50, 100 something plus head of cattle that he's milking twice a day, that could lead to repetitive stress injuries and some musculoskeletal soft tissue injuries. Plus the fact that, okay, he might get pinned up against one of the railings if one of the cow moves. The underwater welder. Okay, well, not only do you welding, so you have the eye protection from the flash burns, but it's in a extreme environment, so you have to consider all of those different factors. And then with the office, well, 2 out of these 4 guys that are here may not be using the best ergonomics. You have the obvious guy slouching in the chair, but then the guy in the middle, you see him kind of hunched over and bent forward with his neck crooked, looking at a monitor. So they might start to get some issues there as well. So when a provider sees somebody, and I was guilty of this in the emergency room, a person would come in and say, okay, well, I got hurt. All right, well, what do you do? Well, I'm a roofer. Okay, well, all right, you sprained your ankle. You probably, okay, well, you can't be climbing up and down ladders with a sprained ankle. So I should take you out of work for a few days. I didn't understand because I didn't have the context of that there may have been other jobs available for the person to do, or they might not have vacation. They might be an independent contractor employee, and if they don't work, they don't get paid. And I didn't understand the impact on the employer with the reporting and the lost time and everything. So by being able to go to these different job sites, I can look and say, okay, well, let's look at some of this. Oh, all right, I understand this is what you do. Is there another way we can do that? And so if somebody does come in, it gives us more info. Part of that is when we do these worksite visits, there's some preparation ahead of time. So we try and do our research as much as possible, at least I do, to know, okay, what is the environment that we'll be going into? What's the company? So if it's a distribution center, like the gentleman with the red shirt and the boxes, well, okay, is it just for one company? Is it for multiple companies? What is some of the organizational challenges that they may have? And part of this will be a 2-way interview. So I'll be asking questions and then completely open for people to ask me questions about my experience, or if they have recommendations or suggestions or ways that they might mitigate some of their concerns. Proper PPE. So with the personal protective equipment. So for each of these 4 environments here, well, with the distribution center, might need to wear a high visibility safety vest. With the food service, so it looks like these ladies are packaging provolone cheese. Well, of course, then we have to consider the hygiene aspect as well. Okay, maybe slippery floors. So with the sawmill, well, it's going to be a loud, dusty, dirty, noisy environment. Do we need to wear a hard hat? Beside safety glasses or face shields, do we need to wear uh, like respirators, these different type of things? The gentleman with the window factory here, we may need to wear cut resistant arm sleeves. So if we do happen to brush up against something, we're not injured as well. So that's part of the thing that we do. And then we understand from, okay, this is what the person is doing on their routine day-to-day job. This is the type of PPE they're wearing. This is the work environment. So then we can help to adjust what we might need to do for their treatment. So now we're going to transition a little bit into the impact on work and being out of work. And so it's a commonly held belief or commonly known that the longer a person is out of work, the less likely they are to return to work, the more, the higher their rate of resource utilization, multiple visits, higher rates of depression, greater financial stresses. And so there's been several studies on this, and one, particularly this first by Stice and Dyke in 2009, they concluded that work-related injuries or disabilities can result in significant negative consequences, physically, economically, socially, because we all have our identity, that we have like our work identity and our work family, we have our family, and many people derive their personal self-worth through their role in society. Well, if you take that away from someone, well, then it can lead to the depression and the negative stresses. Fickett, Tuff, Brinkoff, and Segrist in 2018 specifically talked about that people who are physically disabled, whether it's a temporary injury or illness versus a permanent, that they have a greater risk of completely dropping out of the labor market and never returning to some sort of some sort of work. And then Katsu, Tyak, Mackey, Elliott, McKenzie, 2021, this was just published just a couple of months ago, talk about any failure delay in getting people back to work. They looked at the, just not only just loss of income and support for the family, but then by being out of work with that negative impact on their identity, but also they were looking at, well, if a person's out of work now, how is that going to hinder their future advancement? Maybe a person was in a role where they were working along a specific career trajectory. They were working through a ladder for advancement promotion. Well, now that they're out of that, maybe they're no longer going to be considered for a future promotion, or maybe they're not going to be able to get the training or experience or skills they need to take the next step. So that's where the gradual return to work programs are beneficial. Now, there's alternative terms: gradual return to work, progressive return to work, partial return to work, all pretty much mean the same thing. It's where you look at the nature of the injury, the illness, the characteristics of the person, the work site, the work environment, and then you try and adapt any kind of restrictions to take care of the person, take care of the injury, while allowing the person to still be functional and productive in some manner. And one of the biggest researchers on this was French, and with multiple co-authors, and there's multiple papers by this group. They put out this systemic review. It says right here, provides evidence supporting that workplace return to work interventions reduce work disability duration associated costs. So they looked at it on, okay, if we have somebody completely out of work, what is the difference between somebody that comes back on light duty? How is that going to affect how soon the person recovers, as well as what are both the direct and indirect costs? Now, direct costs, of course, are lost productivity, lost wages, reduced hours. Indirect costs, of course, are your medical resources, the money spent for their medical care, the insurance rates. If a company has a higher rate of insurance injuries, maybe their insurance premiums are going to go up. Maybe it's a self-funded program. Well, now that money has to come from somewhere. So instead of having a higher profit rate, now you have to look at, all right, we're not going to be able to have as much for that. We have to spend it instead on these medically related expenses. A study out of Germany, Bethke 2016, had that graded return to work supports labor participation, reduces the risk of permanent work disability. So by getting the injured person or the ill person back to work as quickly as possible, and then progressively stepwise increasing their ability, their function, can reduce and even eliminate the possibility that the person will go on permanent disability. And then even if they do have some residual issues from the initial injury, they're still back to work. And then that same person then partnered up with Stribelt, Berger, Neuenhuizen. This study came out of Denmark, where they looked not just at physical, but they were looking at more individuals with chronic mental disorders, work-related stress, anxiety, PTSD, some of the others, as well as people with non-work-related medical behavioral health conditions, bipolar disorder, severe depression, and how using these same techniques of graded return to work when people are having crises or they're having worsening problems, if we use those same concepts, we can get those people back to work and productive as well. And then another study by Shaw and co-authors, this one was specifically looking at low back pain, acute low back pain, which seems to be one of the most common things that we'll see. And they said early return to work improves acute low back pain and functionality. So gone are the days of bed rest for back pain. The concept that we have in occupational health is you rest the part, not the person. So you get them moving, you get them. The only time bed rest is, only time you take a person out of work is if they need bed rest. The only time that really bed rest is for if they have surgery or a few other severe medical conditions. Most people, they will recover faster with better results the sooner they get up and moving. And if anybody has personal experience, have had surgery in the last several years, you know that even with joint replacements, that afternoon, that same day, the person's starting physical therapy. They're starting the movements to get that flexibility, get that strength, get that functionality out to avoid deconditioning, where the muscles and everything get out of shape, and then you have higher rates of inflammation, which leads to higher rates of pain, which then leads to lower function. So we're trying to break this cycle. Mass, Cohorn, and McLeod in 2020, this is a study out of British Columbia where they looked at 140,000 plus workers' compensation claims and looked at, okay, how were gradual return to work programs used, at what level, did they find, were there any differences in demographics such as minority groups, ethnicities, occupational factors, and then looking at how to mitigate those so we get a consistent process going to try and get everyone back to work. And they showed that, yeah, the consistent application of these progressive return to work programs can reduce the amount of claims and improve recovery and people's well-being. Now, this is another key, and this ties back into the getting your healthcare providers matched up with the employers. Is Cullen and co-authors in 2018, they did the same, and they analyzed everything and said, all right, it's not as simple as just saying, okay, go back on light duty. There's multiple factors involved, and it's service coordination, fancy term for partnerships with your healthcare providers, with your employers, with your other external resources, work modification, finding those accommodations for the light duty or alternative work, and improving worker health. A healthier workforce has lower rates of injury and illness. Out of shape individuals, deconditioned, just not used to the physical labor, are going to have higher rates of injury and illness. So by looking at taking that whole, an ounce of prevention is worth more than a pound of cure, you have to put that all together and look at this in a global fashion. And so, of course, what the goal is, you keep everybody productive, you keep everybody working, the employees they have their role, and the employers are meeting their mission, the company is meeting its goals and benchmarks, and then you're able to reduce your associated musculoskeletal injuries, your pain-related conditions, your repetitive stress-related disorders, and such. And so this is where the partnerships come into play. On that, you have in 2018, and this is a multiple author paper, several individuals. And the ACOEM is the American College of Occupational and Environmental Medicine. This is one of their formal position statements, which was published, and of course the title there, Personal Physician's Role in Helping Patients with Work-Related Conditions Stay at Work or Return to Work. This was written as a general guide. It outlines what healthcare providers, what our responsibility is to keep people, to take care of them, and to then help get them back to work. This was written for not just environmental occupational medicine providers, but any healthcare provider. And it says physicians, but this includes myself, physician assistants, nurse practitioners, occupational therapists, psychiatrists, anybody related, athletic trainers, anyone that is taken care of. These are our responsibilities. It does provide guidance. It provides a very good outline of the multiple different components of developing return to work programs. As simple as, okay, let's look at basic job site analysis and what the person does, and that can be based off of written job descriptions. It can be based off of direct experience. I was on the construction site. I was watching for 3 years, start from a sweet potato field all the way up to this, when they were starting to run the initial preliminary production line for testing to make sure all the equipment worked. So everything in between, so I could see exactly what the different moving parts were. Well, you have that as well, but also what employers should have, what the employees should know and be doing, as well as any external shareholders. And that's where a nice part of this paper is it discusses the roles each of the different parties have. The patients have the responsibility to be aware, try not to be hurt from negligence or inattention, making sure that they're fit for duty, coming to work, not hungover, or making sure they're adequately hydrated or they've gotten a good night's sleep, or that if they were injured outside of work, that they don't come to work, not able to work. And if they are injured, they can't just basically throw up their hand and say, take care of me. No, this is your job. You need to take, you have participation to get yourself better. We're here to help you with that. Employers, well, that's, of course, under OSHA, else under the 1910 standards, will say, okay, you have to provide a safe workspace. Well, depending on if it's an office versus a sawmill versus construction versus over-the-road truckers, everything's a little bit different. But then having different programs available, identifying, okay, here's are things that we can do if a person in that job description is injured, what other tasks can we have them doing? And then other stakeholders. That's where everyone outside of that. And so it's multiple partnerships. And so by learning who your local providers are, and developing the relationships will then help meet all of these different factors. So do we have any questions so far? Because this is a good spot, part to stop.
Yeah, and actually, Scott, we are kind of running up against the clock, so
Yep.
that probably is a good place for us to end. Just one question has kind of come in, and that kind of related to what you're talking about here. So we have occupational medicine, we have non-occupational medicine, but obviously it's one body, one person, the intersection point. Talk a little bit, if you can, very briefly about the intersection of those two and how the role of maybe the regular primary doctor or the personal physician intersects with that occupational health doc, or in your case, physician assistant or other occupational medicine practitioner.
Right. So that's great. Occupational health, occupational medicine, there's only about 800 physicians nationwide that are certified in board certified in occupational environmental medicine. And so we learn all the different regulatory aspects, and only a few hundred physician assistants, a few hundred nurse practitioners. And there's only 70 occupational medicine physicians in the state of Wisconsin. So 70, and when there's 70,000 injuries, that's like 1,000 people each. So a lot of this care is going to be provided by your local primary care providers, local urgent cares, local emergency rooms. And so just having those relationships with the local providers, and it's easier when you're in smaller towns, if you have that, even with like that old family doctor or nurse practitioner where they have that relationship with the community, they have those deep roots. Many times they're going to know they're taking care of the person for their routine medical care needs, and then now the person's injured or now they got something happen at work and they're now adjusting that. Where we come into play for occupational medicine is we serve as a resource. Many times we can provide consultations. So a provider will refer a patient to my clinic, either myself or one of the other providers. And I actually have a list of our occupational health providers in the Marshfield Clinic Health System. And so these are individuals that can provide a more advanced level. Let's say there's a more complex case. You have multiple different factors, or the person's not recovering, so we can adjust. We also understand the process of the workers' compensation system. Workers' compensation, of course, is a state-to-state program. We have 3 specific chapters in our administrative codes, chapters 80, 81, and 123 or 113. I just goofed that one up. Specifically talking about what is acceptable at what time for work-related conditions, who can determine something is or is not work-related, and then let's say there's a conflict, how to navigate that. And so we can help to get through and manage some of those complexities. Another thing that occupational medicine does is we learn, and as much of the regulatory side. And for example, today I was actually this morning, and when I'm done with this presentation, going back out to a local company here in Neosville and performing exams on the workforce. And so specifically more of like forklift exams, but also hazmat material handlers. They have to have the different respiratory masks, understanding the complexities of like commercial driver's medical examinations, AKA DOT physicals, firefighter exams, FAA pilot physicals are another thing that we can do, as well as some of the long-term disability determinations. Or if a person is able to return to work, maybe they've had a recent medical condition such as a heart attack or a stroke. And of course, now we're starting to see these COVID long haulers, people that have these chronic symptoms after a severe COVID infection that may not be able to return back to their full back to work like they were before, is there's something we can do to identify at what capacity would they be able to work. So all these different factors that we're available for.
Great, and thanks for sharing this list. And again, this is part of the presentation, so you will all receive this. The email, as Ashley sends us out, will go out to our website, and you can pull it down later. We're well past time, so Scott, we're gonna end here a little, maybe a little abruptly, but maybe not. Really appreciate all this information, and again, this is all out here. If you have questions, contact one of your SHP account managers. They can help with any of the business health solution options that we have out there for our employers. Thanks so much again, everybody, for participating today and for your time. And Scott, thank you very much for a very thorough and informative presentation. Really had a good time, and thanks everybody. Be well.
Yeah, stay safe.